All right, Doug and Jimmy here again. So we're gonna do trauma assessment this time. So again, Jimmy is our wonderful patient and/or victim, whatever you want to call him for this. But this time, Jimmy's gonna get a trauma assessment done on him. So the dispatch information is you dispatched for a male in his 20s, fell off of a chair, hit his head on the ground, unresponsive. So that's gonna be our scenario as we come rolling in. So as I approach the scene, I'm just gonna kind of come off screen a little bit just to kind of prove the point. I'm approaching the scene, got my gloves on, PPE is on, BSI, and I'm gonna ask, my scene safe? Proctor's gonna say yes or no, that the scene is safe. So as I'm approaching my patient, scene is safe, I'm looking at him, I'm determining my MOI or NOI. For this one, it's gonna be an MOI. I have a report that he fell off of something. I have a chair over there that it looks like he fell off of when he was taking Christmas lights off of his house, we'll say. Reaching, slipped off of it, and fell to the ground, clearly probably striking his head first from all the information that I'm getting. So what I'm seeing here, head injury, unconscious, is what my assumption is for now as I'm coming up. I'm gonna obviously consider C-spine, and I have my partner, that's what I'm responding with, he's gonna come down here, hold C-spine on the patient for me. I'm just gonna let go because it's only me right now. So C-spine is held automatically. Go through a quick AVPU. I'm gonna come up to the patient. Hey, are you okay? You okay? And if he doesn't respond at all to that, do a little bit of painful stimuli here. No reaction to that, so we're unresponsive on the AVPU scale. I obviously can't determine a chief complaint from him telling me, so my apparent life threat is he's unresponsive, and why, I don't know at this point. So I need to dive into my ABCs right away. My transport decision is going to be immediately priority 1. This is a critical patient, trauma, unresponsive. So I'm going to come up to my patient, I'm going to check airway first, and obviously check for exsanguination. I don't see any exsanguination right now, no blood, don't got to worry about it. So focus on A, airway. I can see his chest rise up and down, he's breathing. I don't hear any abnormal breath sounds out of him, like no stridor, no snoring, no gurgling, so I know air is actually moving. Skin is pink, warm, and dry, so it's adequate breathing. He's able to perfuse with what he is getting. Awesome. If we had to open up the airway, jaw thrust maneuver, grab underneath the jaw, person holding C-spine can do it too, and pull up on the jaw. I'm gonna spare Jimmy here because that's a really uncomfortable move on a patient that can feel. So airway, breathing, covered. Boom, done. Circulation, obviously pink, warm, dry skin as I can see here. You can feel it. Cool, he's perfusing. Beautiful radial pulse, strong radial pulse. Awesome. So I have circulation, and again, do I see any bleeding? None of his clothing is bloodstained, nothing abnormal sitting there. So circulation is all good and intact. So now, again, transfer decision, priority 1. We got to load and go. But my stuff isn't here yet to get him off the ground. My partner's getting the stretcher or equipment, whatever it is, so I have a little bit of time to kill. So you can do 1 of 2 options here for the sheet. You can either do vital signs right now, or dive into your head-to-toe assessment. I'm gonna dive into my head-to-toe assessment just because to me that's kind of the priority, especially if I come up to a patient like this, I gotta figure out the problem, what's going on. So I'm gonna do my head-to-toe. I'm literally gonna palpate and inspect every part of his head. I'm gonna feel around behind the ears, come up his face, check his eyes, check pupil reaction.
Yeah,
If I don't have light, no light, just shadow the eyes and remove. They should react. His eyes are actually equal and reactive. Awesome. Do I see anything in his nose? No, I don't see anything. No discharge, no blood. Don't got to worry about it. Same thing for each ear. Check each ear. Do I have any discharges, any abnormalities, any cuts? Okay, I see nothing on there. Open up the mouth a little bit. Whether it's you pull it up or you're able to just kind of angle down a little bit. Do I see any broken teeth, any blood, any cuts, lacerations in there, anything in there, period. Proctor will say yes, no, yes, no, yes, no to whatever it is that you're checking. But say everything you touch and look. After the head, I'm going to come to the cervical spine. I'm going to feel it. Any abnormalities, deformities, contusions. I didn't feel anything. I'm looking at his trachea for any deviation. I have no tracheal deviation. Checking for JVD, and I have no JVD. And I can feel all the way around for any abnormalities as well. I don't feel any abnormalities. Turn to the proctor. Do I notice anything after inspecting? I'll say yes or no. Moving down to the chest. So I'm gonna check the chest. Obviously I can see chest rise and fall with his breathing, that's good still. I'm gonna palpate his chest. And And if he didn't wince, move, I didn't feel any like bones grinding, anything like that. Crepitus, good. You can also feel on the side here as he's breathing for any of that as well. I'm palpating. Do I notice any crepitus, swelling, bruising, contusions, avulsions, any of that stuff? Yes or no? And if I have a stethoscope here, I can get lung sounds here real quick because I'm at the chest. You can do that in the initial assessment as well for ABCs, because breath sounds fall into that category perfectly fine. I established that he's pinworm and dry, so I wasn't thinking pneumothorax at the time. So I can check here to see if there is one or not. So I check, no pneumothorax, awesome, cool. Come down to the abdomen. I'm checking the core first, because the core is what keeps people alive. And I palpate the upper abdomen, side to side. And feel for any masses, any point tenderness, deformities, swelling, bruising. Do I notice anything to the proctor? Yes or no? So I'm going to be told no. I'm going to check his flanks real quick because I can check them on the sides here for any bruising on the flanks. If I'm not moving them a whole lot, I can obviously pull up the skin, and if I see any bruising there, swelling, deformities, obviously that tells me the retroperitoneal space is obviously damaged in this. Do I see any bruising, contusions, abnormalities to his flanks? Yes or no? Go down to the hips. I'm going to push in and push down. Did I feel any abnormalities, crepitus? Are there any lacerations? Did I notice anything abnormal there? Yes or no? Verbalize inspecting the genitalia. So is the genitalia okay? Right, we're going to say yes for this one for Jimmy's sake. So make sure you say that you're checking the genitalia. Don't skip over that. Then I'm going to come up to the arms real quick. I'm going to do one arm at a time. Again, check for pulse again. He's not going to be able to grip my hand at all because he's unresponsive. So, pinworm dry skin. Do I feel any bruising, abnormalities, contusions, avulsions? Do I see anything wrong with his arms? Yes or no? And do I have a pulse? Yes or no? Same thing for this arm. Go down, feel for the pulse, check the hand, check skin temperature. You can check skin turgor as well because it's one of the furthest points, which is where you just kind of pinch the skin. See how it reacts. For this point, tells me that he's still circulating fluids in his body pretty good. Pinworm dry skin. You can check capillary refill again on his finger bed. 2 seconds, awesome. And obviously whatever I say I'm checking, I'm looking at my proctor. Is this normal or did I find something? Because they're gonna tell you when you check it, okay, hey, there's a laceration there, or there's a broken bone there, there's an angulation there. They should tell you that as you're physically checking. I'm at the wrist, do I notice anything? Yes or no? Arms are good. I'm gonna go down to the legs. Just do one leg at a time. Go down each leg. I'm checking for any abnormalities, lacerations, contusions, swelling, angulations, broken bones, all that stuff. I'm looking for that. I'm saying that for each leg as I go down. He's not going to have sensory response with his feet, so obviously I can't check that, but I can still check for pulses, dorsal pedal pulses on the top of his foot. So make sure you check that at least on him, because if he has pulses, that means that the circulation is able to get that far. That's good. If you don't have pulses down there, that's a red flag for you that you need to say that you have. Whole front of him is completed. If I had a partner here, I could easily check his back real quick. Let's say I use a sheet or a backboard. I'm going to get him loaded. Someone's holding the C-spine still. So they're going to say 1, 2, 3, roll him onto his back. I'm going to feel his back real quick. Do I feel any abnormalities, deformities, swelling, contusions, avulsions, any of that? Yes or no? Proctor will tell you. Obviously, you can check the backside of his butt where his sacral area and tailbone is as well. Do I notice any abnormalities there? Yes or no? So 1, 2, 3. Again, the head counts that for the roll, and we're going to have him rolled on a sheet type thing. Again, if you didn't do vital signs yet, now you can get your vital signs, get your blood pressure, check it, get the actual reading, tell the proctor what you got for reading. They'll tell you the number that they want you to have. Pulse ox for SpO2, get your pulse count as well with your respirations. Also, with anyone unconscious, blood sugar check. Very good thing to get. Once you get your vital signs all squared away there, you get your numbers, carry them onto the stretcher, kerplop. Now we're on the stretcher, let's say, we're boogieing down the road. I'm going to keep reassessing. I'm going to really focus on his ABCs especially. Is he maintaining his open airway, adequate breathing? Are there any spots that are potentially bleeding now that maybe I missed earlier? With the head to toe, hopefully you saw every little part of him for any bleeding, but you're still checking that, make sure that he still has a pulse. Do we still have pink, warm, dry skin? Is it cool, moist skin? Was there any changes for that? Vital signs. Also, if there's any injuries that aren't life-threatening, like broken bones, now you can splint them in place if you need to, so that when you transfer over to the hospital, they're not going to get worse injuries. And I'm just going to keep reevaluating every 5 minutes for that. Ready report or a handoff report to a medic. I have a male in his 20s, fell off of a step that was taking Christmas lights off of the house. Found unresponsive, assumed that he hit his head on the ground. Reports say that he hit his head on the ground and has been unconscious since then. Head to toe revealed no bleeding. He's been able to maintain his own airway the entire time. Breathing status has been good as well. Circulation has been good too. Did not find any other injuries on him. He's just unconscious at this point. And maybe there's bruising starting to form around his head from where he contacted the cement ground on. That's why you always reassess, because you could catch those changes later. So obviously with someone holding C-spine as well, you want to get a cervical collar on as soon as possible. So a good time is before you lift and move onto the stretcher. C-collar can get applied there or once in the ambulance. Make sure you say that you get that C-collar on at least before you're done. Other than that, that's the quick down and dirty. This is the second take of the video because Jimmy had to leave earlier. I did medical tag check on that one. I didn't on this one. So make sure that you're checking for any medical tags as well, necklaces, bracelets. Make sure you're checking all that in case they have some pertinent information on there for medical tag identification. So I believe that was every point on the State of Michigan sheet. So there's your trauma assessment in a nutshell.